Asian eyelid surgery, blink muscle damaged or overexcised skin, incomplete closure. My surgeon won't respond. I am 2 months post Asian eyelid surgery and epicanthoplasty. My eyes won't close completely at night, and my blink is incomplete. Eyes are very dry and irritated. Can't wear contact lenses. My optometrist has prescribed Restis's drops and ointments to protect my eyes. Closure has improved a little since last month, but still worrying. My surgeon keeps dismissing my concerns and says it will resolve. No doctors are willing to refer me to an oculoplastic surgeon for a second opinion. Please help.
Thank you for your question. You submitted your question with several photos, and you are describing in your question a situation where you're 2 months post-op after undergoing Asian eyelid surgery and epicanthoplasty. And you describe in the details of your question that you've been having difficulty with eye closure and dry eye and irritation to the point where you're unable to wear your contact lenses. Your eye doctor prescribed you Restasis and lubricating drops, and you're stating that your surgeon is not taking this very seriously or is being dismissive, and further you are questioning whether or not you should be seen by an oculoplastic surgeon for further evaluation. Well, I can certainly share with you a perspective as an oculoplastic surgeon with situation like yours, in the absence, of course, of a physical exam. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is a very significant part of my practice. I also specialize in revision eyelid surgery, as well as a wide range of both the non-incisional, incisional techniques, and of course epicanthoplasty. So certainly I'm quite familiar with your type of procedure. That being said, I would say that there are certain issues that are important in a situation like yours that I think do deserve attention, and it looks like you are on the right path. To begin with, it is, in my opinion, and it has been generally, I think, well accepted in the oculoplastic community. These are surgeons specializing in eyelid surgery who also trained in eye surgery in ophthalmology, that eyelids that look good function well. And so there has been a perception in the general plastic surgery community to some degree that it is a norm to have difficulties with eye closure and with dryness after surgery. So to give you some clarity as to how I advise my patients, or at least perspective, I basically explain that any surgery done around the eyes can temporarily cause some degree of dryness. Now, this is more of a function of the possible reduction of baseline tear production from any procedure occurring around the eyes. So for my contact lens patients, I often say make sure that if you are, particularly if you have a very high prescription where you really need to wear contact lenses, and that you have your contact lenses available, but wear them with a lot of lubricating drops and see if you can tolerate that. And again, between that, also providing yourself with lubrication of the eyes with rewetting drops like artificial tears. Now, given that you're having a challenge with eye closure that you also describe as improving since the previous month, this is particularly important, not so much during the day, but where we would describe it as forced blinking, where you're awake and aware and you blink your eyes to compensate for dryness. But I would say that it is also important to be aware of what your eyelid opening is if it opens passively at night when you sleep. I often recommend that when a patient comes for a consultation or a second opinion for difficulty with eyelid closure, I recommend the use of an ophthalmic lubricating gel at night to allow for proper lubrication, because when the eyelid is gapped, there's going to be evaporation of tears and it can result in more irritation. Further, I also recommend the typical dry eye management strategies, not just lubricating drops, but I also tell patients to put a humidifier in their room when they're sleeping, just to add some moisture to the ambient air. But in addition to that's for managing the eye exposure. Now the question now is really, is there a relative skin shortage? Or is this more a manifestation of just short-term muscle being affected, or the nerves that affect eye closure? Now, it is difficult right now to make that determination based on the photos you submitted. And it is not unusual for someone to have these symptoms at this point, even though there might be either a small skin shortage and some degree of nerve dysfunction after this surgery, that over the course of several months, the area does get better, the function does improve. So the key to the strategy, whether you see an ophthalmologist or an oculoplastic surgeon, is still to primarily protect the eyes, to protect your vision, to protect the health of your eyes. I think that your surgeon being dismissive may be just a challenge in communication skills, maybe simply anticipating that this will likely resolve without any type of additional surgical intervention. So I think that for now, I generally tell my patients who come for a second opinion, like yourself, that as long as your eyes are being properly lubricated, and even if you have to temporarily forego wearing contact lenses, basically you need to allow about 6 months to even a year to let the eyelids heal before considering any additional revision surgery. Now this is again in the absence of a physical examination, but I think if you are able to manage your dry eye symptoms and be proactive as well, even when you don't have the symptoms, to continuously lubricate your eyes, I think you'll be able to get through these next few months without having to have any other intervention at this time. So follow up with your surgeon, and of course also work with your eye doctor in managing the lubricating issue with the dry eye symptoms and the eye closure, and hopefully you'll be able to get through this without needing any additional surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.